Hi everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my D3, which is statistics. So this is the D3 week 96 and we just redo the D3 from week 95 because we felt that we need to do it again. So I'm going to talk about the questions that Mrs. Pratt asked us in the D3 this week. Now, Mrs. Pratt asked us to list out the data analysis tools to assess these five main situations: how to assess patient conditions, diagnose patient conditions, improve diagnostic accuracy, enhance hospital workflow, and make decisions based on evidence. So let's get started on our first part, which is assessing patient conditions. So basically, I'm going to talk about the techniques and also the physical tools that they use to list out the statistics, helps them to analyze data. So firstly, I'm going to talk about the techniques to assess patient condition, which is descriptive analytics, diagnostic analytics, and predictive analytics, as well as prescriptive analytics. First way is prescriptive analytics. So prescriptive analytics is the first step. I need to understand what happened. So we need to understand what happened to that patient, and the tools used are simple statistics like counts, averages, percents, reports, dashboards, etc. And how it assesses conditions. Well, using the descriptive analytics, they summarize. When using the descriptive analytics, I basically summarize large amounts of patient data like vital signs, heartbeat, blood pressure, breathing rate, things like that, and lab results to identify the trends and patterns in a population or in that individual. And that is descriptive analytics, that is understand what happened. Moving on to the next step, I will use diagnostic analytics and understand why it happened. Now, the tool used is the root cause analysis. So the root cause analysis is basically ask why 5 times. Why is this patient having this kind of disease? And why is that patient having difficulties breathing? Why is that virus in that patient's body? And how did it get there? Things like that. So that is root cause analysis. How it assesses conditions is find the root cause and contributing factors to the condition or sickness. That is diagnostic analytics. Next is predictive analytics. The next step is forecast what will happen. Now, we've already talked about what happened, why it happened, and now we're going to talk about what will happen. We are predicting and forecasting the future events. So to calculate patient's risk score for future events, and this helps with early intervention. So the tools and techniques used are machine learning, algorithms, and statistical modeling. So that is predictive analytics. Lastly, the prescriptive analytics is the last step, which is what action is needed. Now we know what happened, why it happened, and what will happen. The last step is to determine what action is needed. So the tools like the CDSS, which is the Clinical Decision Support Systems, which I'll talk about later, optimization algorithms, and rule-based systems provide specific, actionable, achievable recommendations for patient care based on data analysis. And I've talked about the tools before, next is diagnose patient conditions. We talked about assessing patient conditions. The next problem is diagnosing patient conditions. Now, in this step, I use the four main parts, which is descriptive analytics, diagnostic analytics, and predictive analytics, and prescriptive analytics. So let's break down each. Now, for prescriptive analytics is summarize. Using this, I will need to summarize and organize the historical data. So, for example, the for descriptive analytics is an example of this is tracking the number of patients with a symptom within a specific region. That is descriptive analytics. Next is diagnostic analytics, which is investigate underlying causes and contributing factors to that particular health condition or disease. That is diagnostic analytics. An example of this is using root cause analysis to determine why a patient have that complication. So again, root cause analysis, ask why 5 times diagnostic analytics. Next is predictive analytics, which is, if we recall, why did it happen? Now, for this, I will need to use statistical models, machine learning algorithms to forecast future events, risk, and disease progression. For example, I can use these statistical models and machine learning algorithms to identify a patient at high risk of developing diabetes based on their genetic, lifestyle, and their clinical data. So that is predictive analytics. So this technology and platforms and softwares will be able to process all that information and give us decisions on help us with the decision-making process. Next is descriptive analytics, which is recommend specific actions based on data-driven insights. An example is a clinical decision support system suggests the most effective drug dosage and treatment plan based on their unique characteristics and predicted outcome based on the patient's predicted outcome in the first step, in the third step, and their unique characteristics. So that is for the diagnosed patient conditions. Moving on to improving diagnostic accuracy, I've talked about CDSS. If you're wondering what that is, it is like basically a software, a platform that provide alerts, reminders, diagnostic assistance by processing patient-specific data against a vast knowledge base to suggest the potential diagnosis. So that is the first one, which is CDSS. Next is radiomics. So this is a software platform I've talked about before, that uses advanced data analysis to extract a large number of quantitative features from medical images. So we have that raw image from that raw medical image put into that software, that platform, and then it will help us to analyze that data. The features within that medical images are then analyzed using machine learning to identify the patterns within that individual. So that is radiomics. That is how we improve diagnostic accuracy. The fourth one is enhance hospital workflow. Now, to enhance hospital workflow, we will need to have softwares, platforms in the world nowadays, in the technology world nowadays. We need to adapt to the ever-changing world. We will need to have softwares and platforms like, for example, data visualization tools like Tableau, Microsoft Power BI, Looker, etc. So those are the softwares or platforms that will help us to visualize data. Next is interactive dashboards. This will help us to visualize key performance, which is KPIs, information, key performance info, to quickly identify bottlenecks. So bottlenecks is like a point which is a thing that like blocks something, like prevents that workflow. So like a problem within the system that prevents that workflow, and that's basically a bottleneck. And lastly is reporting, and these softwares can generate reports on quality measures like readmission rates, etc. The next type of tool that I want to talk about that will enhance hospital workflow is timetables, charts, tables, graphs. This is the physical thing and traditional thing that we probably used in the medical field. So we will have those charts, tables, graphs, and also schedules to help us plan and delegate tasks evenly, know who will do which job, and it won't get mixed up, the roles won't get mixed up, and we will save valuable time when we use these timetables, charts, tables, and graphs. The staff will look at it and know what they need to do. So that is the enhancing the hospital workflow. Finally, the last situation is making decisions based on evidence. So this is using visualization tools again. It will help to create reports and dashboards and turn raw, complex, raw, complex data into accessible, readable data. So yeah, that is make decisions based on evidence. Using this visualization tools, we can use our knowledge to, based on that, make decisions. After all of these steps, and going to the last step, we will know how to make decisions and find the correct treatment and also the correct drug dosage to give to that patient. And that is all for my D3 of statistics. I hope that you learned something new from this video or just review some of the things that you have learned. If you have any other questions, opinions, or suggestions for improvement, then I will be glad to hear it. Thank you for listening to my video and I hope to see you soon. Goodbye!